Hello everyone, this is Dr. Taposh and welcome to our channel Physiomax Organization. As we are continuing our medical education series and under the part of glenohumeral or the shoulder joint pathological condition, we are mostly seeing the different type of causes, different pattern of injury of subacromial bursitis. Already few episodes of the subacromial bursitis, we have already seen the causative factor of the subacromial bursitis, in which pattern and in which way the patients or the population is to have a subacromial bursitis, and with very easy few physical findings which we can gauge that it can be a subacromial bursitis. And also we have seen the difference between the supraspinatus tendinitis and the subacromial bursitis with a basic physical examination. So today we will see the special test which is having its high sensitivity value to diagnose the subacromial bursitis. We will be seeing the exact way how to perform the special test for a patient so that we can diagnose that it can be a subacromial bursitis. So the name of the special test is DAWBARN'S test. So DAWBARN'S test, DAWBARN''S. This DAWBARN'S test is mostly indicated to diagnose the subacromial bursitis. This DAWBARN test is having its high sensitivity value. Now we will slowly understand the how the test is done, what is the patient position, what is the therapist position, where exactly the therapist will hold, and also what is the procedures of doing this test, and also if the test is positive, what will be the findings? If the test is negative, what will be the findings? But before that, we need to understand a simple understanding of a painful arc and the mechanism of a arm movement. So first we need to understand that subacromial bursa, as it is present just below of this acromion process, and whenever someone is to leave the arm in this position, the subacromial space it is to have a increased in its own size, and the deltoid muscle at exactly the 90 degree it guards the subacromial bursa. So whenever you are in a 0 degrees of neutral position of the abduction, your subacromial space is narrowed as it's having a minimum space. But the time you will do the abduction of the deltoid muscle, that's the time at the exact 90 degree the deltoid guards the subacromial bursa. So this is first we need to understand as a part of a basic glenohumeral abduction mechanism. Now we need to understand what is the another name of this DAWBARN'S test. So another name of the DAWBARN'S test, it is also named as a push button test. We will understand slowly why this will be named as a push button test. So to understand this test, first we will understand the first point, it is the patient position. So first we will understand the patient position, then we will go with a therapist position, then we will go with a point of therapist hold, then we will go off procedure, that's the procedure of application, and last we will understand about the rationalization. So under this 5 point only we will read the special test of the DAWBARN'S test or the push button test. So what is the first point? Patient position. The second point is the therapist position. The third point is the therapist hold. Fourth point is the procedures of application, and the fifth point is the rationale. So one by one we will see the position of the patient and what will be the therapist procedures while doing this DAWBARN'S test. So first you will need to make the patient to get seated. Patient, either it can be a relaxed sitting position, and the therapist, they need to stand on the side of the patient. Consider this is the therapist and this is the patient. The patient at the initiation of the movement, that it will be a 0 degrees of abduction position, and in this position therapist will give a pressure at exactly the subacromial space. So consider this is the subacromial space and the therapist is giving the pressure over here, and in this position the patient is supposed to feel the pain. So again, in the sitting position, relaxed sitting position, when the arm is in a 0 degrees of abduction, therapist is giving a pressure at the level of the subacromial space and the patient should feel the pain. Now slowly the patient will leave the arm at 90 degrees of position. Consider this is the 90 degrees of position, and when the patient will leave the arm in a 90 degrees of position, and that is the time when the therapist will give the pressure at a 90 degrees of abducted position, the at 90 degree, at 0 degree, pain will be positive, but at 90 degree the pain it will have a reduction or negative. So here it will be positive, here it will be negative. So now we need to understand not only about how to perform the test, what is the rationale behind this, why this thing is happening. The reason why the DAWBARN'S test is positive when at a 90 degree the pain is reduced, we need to understand the exact pathology and the exact mechanical changes what's happening inside of the glenohumeral joint, and that's what's the rationale. That is, when the arm in a 0 degrees of the position, at that same time when someone as the therapist will palpate just exactly here as a subacromial space, there is a pain, because at that point the subacromial bursa is pop out. But whenever we used to do the abduction of the arm at 90 degrees of abducted position, the deltoid guards hold the glenohumeral joint. So whenever at a 90 degrees of position we used to palpate the subacromial space, we exactly used to palpate the deltoid muscle. We cannot palpate exactly the subacromial space. That's the first cause. The second cause, why it is named as a push button, the reason is at a 90 degrees of a abducted position, the subacromial bursa it just flows inside, and at a 90 degrees of abducted position the subacromial bursa we cannot palpate, and that's how the pain is to get reduced. So this is the exact scenario what is exactly happening as a part of a DAWBARN'S test and the push button test, and as this test is having a highly sensitivity, we can easily perform this test to understand that is a subacromial bursitis or not. If there is a confusion that it can be a subacromial bursa or not, so we can go with some other test to rule out the pathological condition like the supraspinatus tendinitis or the rotator cuff tear, because all the pain mimics of a same. But before performing any special test, we need to remember does this special test falls within a red flag period. If it is within a red flag period, every test will be positive, and that's the time we cannot perform any test. But if we perform in a subacute phase, that test is to go for the positive result. So with this DAWBARN test or a push button test, we can easily find that the test is positive or negative with a pain reduction or pain elevation. If the pain get elevated, then it can be supraspinatus tendinitis. Again, to rule out that it is a supraspinatus tendinitis, we used to do the test for the supraspinatus tendinitis. So this is how with this special test we can easily understand about the subacromial bursitis. So I hope with this clinical reasoning we understood that how with a DAWBARN'S test we can diagnose a patient of a subacromial bursitis. I hope you will understood. Those who are yet having any doubt, don't forget to comment in this comment box of our channel, and those who are liking this type of educational videos, don't forget to like this video, and those who are new for this channel, don't forget to subscribe our channel. Thank you. Thanks once again. And also I forgot to tell another thing, that in the next video don't forget to watch the next series of our video. That's why again I came back. That's how to manage the subacromial bursa. What is the therapeutic management, what's the medical management of the subacromial bursitis, and that's supposed to be the evidence-based therapeutic management of a subacromial bursitis, we'll be seeing in the next video. So don't forget to watch our next video and the series of a different orthopedic pathological condition. We will be covering the whole body, the whole joints, all the types of soft tissue injuries and related pathological condition. Thanks once again.